Hi, Dr. Mike Kwast here with iChiro Clinics. Welcome back to your second visit. You should have gotten your pathway to health last time. This is the second step in that. Your third visit and your fourth visit are next. These first four visits, what they do is they help us to be able to see, number one, where your problems are so we know if we can help you. That was last visit. This visit and the next one, we're actually going to do a treatment with you so we can see how you respond. And then on the fourth visit, we're actually then going to predict what we think you need, how long it's going to take, how many visits you need, what your costs are, and all of that so you can choose and decide what you want. With these treatments, everybody responds differently. Some people feel better, some people are sore. If you think about it, the first couple of visits, we're not going to change a lot of muscle, but if you feel better in a visit with a visit or two, typically you're going to respond faster overall. If you're sore after a couple of visits, you're probably going to take a lot longer. So that will help us have that information when we're estimating for you to be as accurate as possible. Obviously, the last time you were here, we tested you. We went through our examination to find where your weak and damaged areas are. Those tests that we did with you will determine where your malfunctions are and where your problems are coming from. The cool thing about those tests that we did with you is they actually will find problem areas and areas that you're susceptible in, whether they're hurting or not. So your goal is to be able to do as many of those functional tests as possible. The more of those functional tests you can do, the better your function will be, the less susceptible to having problems you will be. So today I was going to give you some information, explain some of this stuff so that you can understand how it works. What we found are the patients who understand everything the best get the best results, which is what you want. And so we're going to teach you how all of this stuff works so that you can understand, and then that way you're making informed decisions and choices about what it is that you want to do so that you can get the optimum results, so that you can keep your function high and when you're 85 years old still be doing the things you want to do. Sound good? The next thing I'm going to show you is our nerve chart, and we're going to show you where all the nerves go to and how this works. If you want to go ahead and take your chart out, it looks like this. You should have gotten that when you came in. If you take a look at that chart, it shows you where all the nerves come and go out of your body. The cool thing is on this chart is you can see where those nerves come out between each vertebrae and then where those nerves actually control in your body. If you weren't aware of it, nerves control everything in your body. There's nothing that's going on in your body that your brain is not controlling through this nervous system. And every nerve goes back through your spine up to your brain. What's cool about this is you can sometimes see things that nobody thought about being a chiropractic problem because they're not thinking nerves. I'll give you an example. I had a guy come in one time and he didn't want to come in. His wife's making him come in. So you can imagine how well that's going to go, right? He doesn't want to be here, so he's being forced by his wife to go through everything. Well, he has terrible middle back pain, and she's tired of him complaining about it, so she brought him in, and we're working on him. And every time he comes, he's grouchy and grumpy, and it's hard. So one day he comes in, and he's happy and super excited, which is odd and unusual. So I asked him, I said, what are you happy about? Because you never are. And he said, well, I can't believe it. I haven't had to take Pepcid AC since I started coming. And I said, what are you talking about? I didn't even know you took Pepcid AC. And he goes, well, I didn't tell you because it has nothing to do with my back. That's my stomach. And I said, well, yeah, right. Hold on a second, though. What are you taking the Pepcid AC for? And he said, well, I'm taking it because my stomach makes too much acid. The doctor said my stomach's overproducing acid, and so then I take the Pepcid AC, which neutralizes it, and then I feel better. And I said, oh, all right, well, how long you been doing that? And he said, I've been taking that every day for 5 years. And I said, oh, well, obviously that's not fixing what's wrong. What do you think is causing your stomach to overproduce acid? Because that's the problem, right? And he goes, well, I don't really know. Nobody really knows. We just know that it is. And when I take the Pepcid AC, that kind of blocks it. And I said, yeah, it's blocking it from happening, but guess what you get to take tomorrow? More Pepcid AC. So it's not fixing it. And I asked him, I said, what do you think tells your stomach how much acid to make, in what amounts, at what time, when to put the different enzymes in from your pancreas, from your gallbladder, everything mixing and sloshing around in there, moving into your duodenum to be digested? I mean, is this all just luck and chance, or is there something that's guiding and governing that whole system? And he goes, well, I guess that'd probably be your brain. And I go, yeah, and how did you think your brain's getting the messages down to your stomach? And he said, well, obviously through the nerves. And all of a sudden a light bulb went off and he realized, oh my gosh, this could be connected. And I said, yeah, it's not coincidence, but take a look back at the nerve chart and look and see where those nerves that go to your stomach come from. And he pulled the chart out and he looked, and lo and behold, guess where they're coming from? The middle back, right where he was having all his problems. So as we got to work on those muscles and tissues in his middle back, that started to work better. The problems then went away. He was so excited about this, but had absolutely no idea that we could help something with his stomach because he didn't see how that was connected to his back. And this is a problem in the public. Just ask any of your friends next time you go out. Say, hey, I'm going to the chiropractor for acid reflux, and they'll all laugh at you because they don't understand anything about nerves or how that's all controlling everything in your whole body. Pretty cool stuff. All right, the next thing I wanted to show you was a little graph that I made up to help you understand how this works. So I'm going to take out a little piece of paper here and I'm going to draw this and follow along with me and answer the questions in your own head as we go through so that you can understand this. Because again, your results are on the line with how well you understand this. So the question is, what controls everything in your body? And when you look at that, it's going to be your brain. And how does your brain do that? Through nerves. Nerves control everything in your body. They're sending messages back and forth from your brain. And when this system works well, how do you think your body will function or work? It will work great. And that's what's called normal. We call that a state of good function or a state of ease. What happens is when you do stuff in life, you slip, you fall, you shovel, you sleep wrong, you sit at a computer for the last 15 years hunched over. You do things in life that cause the little tiny muscles in your back to get damaged and hurt. They're called stabilizer muscles. When these stabilizer muscles get injured, they're going to contract and tighten, they're going to spasm down, and then they're going to pinch and irritate those nerves. When that's happening, what do you think is going to happen to your body's function? It starts to do what we call a malfunction. It starts to go wrong. But here's the thing, you feel fine. Over time, as you malfunction, what do you think happens to your state of ease? Right, it gets worse, it becomes a problem, which is what we call a state of dis-ease or disease, a disease process. Things are not working well. Here's the problem though, you still feel fine. Then what happens as time goes on, it starts to get worse, and once your function gets low enough, usually below about 40%, you'll start to experience symptoms. And this is what you feel: the neck pain, headache, stomach ache, allergies, asthma, the back pain, whatever the symptom is, it's got to get bad enough before you feel it. And then you're in a state of symptoms. So here's the problem. Most people think that a problem occurs when they have their first symptom. The problem is that's not really the case. In fact, think about this for a second. If you only went to the dentist when you had tooth pain, how would that work out? Think about it. If you went in and you said, hey, I'm feeling great today, doc, and he just said, well, come back when your teeth hurt. I mean, you would have no teeth. They would all be in a big problem. Same thing when you go to the medical doctor. You go to your medical doctor and then they want to do some tests with you. They want to do, perhaps you want to get a mammogram, a breast exam, a pap smear. That has nothing to do with how you're feeling. It's about testing to show you how you function. Just like those tests we did with you on your first visit. Show us how you function, irregardless of how you're feeling. The key is by acting early on your testing before you hurt, you can prevent a lot of problems. And wouldn't you rather prevent a problem than suffer with something, especially when you knew you could have prevented it? Let me show you one more piece on our graph. Most people end up in symptoms by starting out at 100% function. Usually you're doing great when you're a little kid and everything's fantastic. But then you're slipping, you're falling, you're shoveling, you're playing football, you're falling down the stairs, crashing on your bike, playing soccer, getting hit in the head, doing all the things that we all do as we grow up. And all of these little things are doing those little pieces of damage on our bodies, causing those deep muscles to be hurt. They contract and pinch. And these build up over time. So they stack up kind of like straw on a camel's back. And eventually you're going to get to the point where you drop below that 40% line and suddenly now you have symptoms. When you're having symptoms, then all of a sudden you realize there's a problem. However, the problem had been already going on. It just wasn't bad enough that you felt it yet. Most people will come in when they're symptomatic. So when you're down here in the bottom and you're symptomatic, when you come in, if we were to work on you, and turn you around, as you moved up the chart, as soon as you crossed the 40% line, you would feel totally fantastic. You would feel like you're at 100%. The problem is 40% is not the same as 100%, even though you feel the same. If we were to get you to 40% so you felt good and we just completely stopped and said, have a nice day, come back when you hurt, the next little thing of life that you would do would push you right back over the edge into your symptoms again. And doing that over and over and over is going to allow things to just continuously get worse and have more problems over time. So not really the best solution. So what would be better? What would be better would be to try to move up as high as you can on that graph. Bring your function up as high as possible, as close to 100% as you can. Now, nobody's ever at 100% because everybody's going to die at some point. And nobody lives forever, is bulletproof. Everybody has issues. So it's about trying to make you last as long as we can. So bring your function up as high as we can get it. Once it's up there, are you still going to do stuff? Of course. So here you go, another slip, another fall, another day at the office, and you're going to start sliding back down. But what if we pulled that stress and tension out of there right then and there before it was even hurting and before you even knew it was there? And then we just did that on a regular basis. You would actually prevent problems. You would prevent the stacking up, the straw on the camel's back idea, and you would prevent things from occurring, which is called preventative care or maintenance care. Which, if you think about that, who do you think should be doing that? Right, it's called everybody. It's just people don't know about it and they don't understand. So the key is to get to that level and then keep it there. Now here's the big question. Once you get to 40% and you're feeling fantastic, how are you going to know where you're at? If you're at 40%, 50, 60, 70, 80, how would you know where you are? Because you can't base it on how you feel. It's a tough question. The answer is by all those tests that we did. So all of those tests will show you. If you can do all those tests with no problems, then we know that you're at high function and then everything's working great. If you can't do those tests, then we know your function's poor and you're susceptible to having problems and very likely to just have a flare-up in another issue. So the tests, by redoing those, which typically we repeat those tests about every 12 visits so we can actually see where you are, and then that way you know where you are, so you know if you're walking around a susceptible time bomb or if you're walking around in a good place. Wouldn't you rather know if you're about to have a problem than wait till you have a problem? Most people would say yes. Make sense? All right, so the next step, if everything's making sense to you, is to get worked on. And this is where we do actually an adjustment. And there's two different ways we can do adjustments. We can do a manual adjustment. All right, so with the manual adjustment, what we're gonna do is we are gonna poke around and find where the muscles are tight and compressing your joints. When we find where that is, we're actually just going to push gently into that area and those joints will open up. As the joint opens up, you often will hear a cracking or popping noise as those gases in the joint actually release and fill the joint with air. It's pretty cool. It's not your bones cracking. It's actually liquid in the joint turning into gas rapidly, releasing energy. If you think about that, it will fill your joint with a cushion of air. What do you think that does to the cartilage in your joint? It protects it. You want a cushion of air inside your joints. So that's what the manual adjustment's going to do. And we're going to check you by pushing and finding where that is. Or we can do a computerized adjustment. The computerized adjustment, we're using a computer to find where your joints are compressed and where the pinching is occurring. So the computer is going to scan up and down your back and show us where the muscle tension is compressing the joint. Once we find that, the computer is going to show me. We'll put the instrument on that spot, and this instrument will actually reflexively cause your muscles to relax around the joint, which will allow it to gradually open up. You typically don't hear cracking and popping with the instrument because it does it slower than a manual adjustment would, but often that's more comfortable for people to tolerate. So a lot of people prefer that technology. We're then able with the computer to go back and redo the same scan that we did in the beginning so we can see before and after and compare both. Those are two of the options that we have, and there's numerous techniques. And you can see the two different types, and then we can make a decision about what you want to do as far as which type of adjustment. The next thing too is we're going to want to do some mechanical traction with you, which will show you that, what that looks like. And we also recommend you do our vibration plate therapy. Massage therapy is also another important piece. What happens is we found that people that do all of these therapies in conjunction, the therapies build on each other because they're doing different things and give you the best chance of getting results. So after your treatment, the next step is to schedule another one. This is your second visit on our pathway to health. The next visit, we're going to do a treatment as well. And then the time after that, we're actually going to be able to give you some estimates as far as what we think it's going to take. We're going to be able to predict what therapies we think you need, how many visits you're going to need, what your insurance covers, what they don't cover, all of that, so you can see what that is, so you can decide what it is you want to do. All right, now you understand how everything works and the different types of adjustments that are available. If you want to head up to the front, they'll find a room and we'll get you worked on.